Hi and welcome to CVTV. Today we're going to learn all about high blood pressure and what that means. So, Dr. Osborne, when we think of blood pressure, what is that? What does blood pressure mean?
So blood pressure is a good thing. Blood pressure is a measurement of the pressure of the blood against the walls of the blood vessel, and there is a normal range that we should operate as far as blood pressure goes.
So blood pressure is what's pushing the blood through the body.
That's
it's
correct.
The pressure behind pushing the blood. And blood pressure comes from where?
So blood pressure really is a function of a couple of things. One is our heart and how much blood it pumps into the circulation. That is how many cc's or how much volume it pumps into the circulation. It's also a function of heart rate, and it's also a function of the constriction of the blood vessels. So when the blood vessels are nice and relaxed, the blood pressure is low. When the blood vessels are very tightly constricted, the blood pressure is high. And it's a function of all those three things, all interacting at once.
I know you got your PhD in vascular biology, so you're a real expert at this. When I went into medical school, I thought what happened is the heart pumped, and you had these static tubes, and the heart pumped, and so the top numbers when the heart pumped down all the way, and the bottom numbers when the heart relaxed all the way. Right?
That's correct.
When you think about the heart pumping and the blood vessels, are the blood vessels all the way opened or all the way closed at a given moment in time?
Well, there's something called tone. So there's always tone. There's always a degree of constriction of the blood vessels, and they're about halfway open, if you will.
So what happens if all of a sudden they open?
So if they open completely and rapidly, that can make you pass out.
Pass out. So fainting is when the blood vessels open up?
Mm-hmm. That's correct.
And so that happens. Sometimes people get emotionally upset or something comes up and their blood vessels open, and then nature has a way to get your head below your feet, doesn't it?
Absolutely. You suddenly go from vertical to horizontal very quickly.
So how do we measure the blood pressure inside a person's body?
The easiest classical way is using a cuff, where we basically exert a pressure on the upper arm. And actually how we do it is that pressure exerted upon the upper arm, we exert enough pressure to collapse the blood vessel. And when we do that, that defines the top number, the systolic blood pressure. We then let the pressure out, and when the vessel completely comes back, then that defines the bottom number of the blood pressure, the diastolic blood pressure.
So what's an ideal blood pressure?
Normal blood pressure is less than 120 on the top and less than 80 on the bottom.
And what's happening inside a person's body as the pressure starts to move up?
As the pressure goes up, the vessels begin to constrict. Sometimes our body produces extra hormones, particularly at the level of the kidney and the adrenal glands, that cause our volume of blood to go up. And that, of course, the more volume there is in the blood vessels, the higher the pressure. Sometimes the heart rate goes up. Sometimes our heart beats harder and faster. All of those things can contribute to elevated blood pressure.
And why is that bad? What is the damage that occurs that make us want to treat that process?
When people have high blood pressure, the main targets, the main organs that it affects are the brain causing strokes, the eyes causing blindness, the heart causing heart failure, and the kidneys causing kidney failure. And also high blood pressure contributes both to the progression of plaque in the blood vessels and also facilitates the rupture of blood vessels and the rupture of these plaques, which ultimately causes the plaques that form in the neck, which causes strokes, the plaques that form in the heart to rupture and suddenly go to having a heart attack or a stroke.
Wow. So if you keep the blood pressure down, do you somehow slow or keep that from happening?
No question. In fact, we know that people with normal blood pressure, and this is defined in people with blood pressures about 115/75, that every time we go up from 115, 20 points at the top, so as we go from 115 to 135, or 10 points at the bottom from 75 to 85, that just that little jump there has now doubled your risk of a fatal stroke or a fatal heart attack.
You actually have a pretty neat graphic of this, so perhaps you'd be willing to walk us through the graphic and share with us what it's showing.
So this is a very useful tool. We call this the blood pressure map, because maps tell us where we're at and where we want to be. And that's really what this does. And this really explains in a very simple way, but a very effective way, but also a very truthful and comprehensive way, what blood pressure means, where it should be, or as I tell people, once we're done with this, we'll know when we measure the blood pressure, whether we do it at home, whether it's done in a doctor's office, are we good, are we bad, are we ugly?
So what are the numbers?
So if we look, I always start with what is the definition of high? High blood pressure is when the top number is higher than 140 or the bottom number is higher than 90. That is high blood pressure. And so what happens is with high blood pressure, again, the higher that number, either one of those numbers, the higher the risk. Again, high blood pressure is greater than 140 in the top or less than 90 in the bottom. But if you look at normal, normal is less than 120 over 80. And you go, wait a minute, normal is less than 120 over 80, high is 140 over 90. Well, what about that zone in the middle? Even that zone in the middle, we used to call it high normal. We don't call it high normal anymore. We now call it pre-hypertension because it's not normal. Because even those people with high normal blood pressure have twice the risk of a fatal stroke or heart attack versus someone with normal blood pressure.
Fascinating.
And again, every time we go up 20 points in the top or 10 points in the bottom, our risk of a stroke or heart attack has doubled. So that by the time we're up to 175 on the top or 105 on the bottom versus someone with normal blood pressure, we have an 800% greater risk of a fatal stroke or heart attack.
Wow, that's really scary. But I want to talk from the perspective of a person, like a patient. I'm a family doctor, you're a cardiologist. People come into our office and they sit down, they stick their arm out, and suddenly the nurse looks at them and goes, wow, has your blood pressure been high before? And so now I'm that person. So I'm going to play the role of the person who's just been told they've got high blood pressure. And I want to know from you, doctor, should I be concerned? Does my blood pressure go up and down? The blood pressure in the office here, is that what it is all the time?
What I would have you do, if we're concerned about high blood pressure, is I would, first of all, do a simple experiment. Let's get you a blood pressure cuff. We're going to have you check that at home. In fact, I tell people to do it in a very precise but simple way. I'm going to have you check it at home with a blood pressure cuff, not the wrist monitors, but with a blood pressure cuff. I want you to do it in the morning when you wake up, and I want you to keep a log. I have people check it in the morning because that is the highest blood pressure of the day. And in fact, we know that disproportionately most strokes and heart attacks occur in the morning when our blood pressure spikes. And that's why I want to sample in the morning.
So I'm the patient, you're saying, Scott, go take your blood pressure, get a cuff, and you're empowering me to start to look at the numbers. So I take my cuff and I go down and I keep my journal, and what I find is in the morning my blood pressure is 145 over 92. And so, Dr. Osborne, I'm back in here today. Here's my table. In the morning it's 142 over 92, and in the evening it's 138 over 90. Do I really need to be on medicines?
If we've done that in the setting of watching our salt, trying to lose weight, exercising, those are very effective, simple, non-pharmacologic ways to treat and lower blood pressure. If we've done all those things, then frankly, we need to lower that blood pressure.